Welcome to Medico Memoirs, the podcast where we discover the fascinating facts of healthcare and explore the amazing journeys of healthcare professionals. I am your host, Jabirul, a medical student passionate about connecting you with the medical world. In each episode, we sit down with incredible individuals who bring a unique blend of expertise, passion, and empathy to the world of medicine. Together, we navigate the intricate connections between science and humanity, uncovering the unsung stories that make healthcare full of experiences worth sharing. In today's episode, we will be talking with Dr. Lela who is a licensed pediatrician and also a lecturer, and she has also won the award of Miss Empathy by her students. We will not only talk about her experiences as a pediatrician, but we'll also be talking about the different challenges that doctors face on a day to day life and how to navigate through them easily by having a positive outlook towards life. She will also be giving us a lot of life hacks as doctors which we can use. She will also be sharing her life's unique motto of how to make the world better with my life. And now, let's dive into today's episode.
Hello, ma'am. Welcome to the podcast.
Hello, thank you for the invitation.
Yep, thank you to you too for coming on the show. And on this episode, we'll be discussing about your unique experiences in the medical industry. And also, we'll be talking about how we can handle a lot of cases with empathy and kindness.
I'll be happy to share that.
Yeah, sure. So, first of all, would you be please be willing to share with us how did you choose the medicine? Like, what made you choose medicine and being a doctor?
Actually, for me, since my childhood, it was very important to help people to make others happy. So, the medical field was the closest profession that we could choose to do this in life. That is why I think that being a doctor is kind of my passion because I love helping others.
Has there been any reason or an incident with you which made you want to help others?
I can't say that there was any kind of special fact in my past life, but I just feel happy when I help others and make others happy. So that makes me even more yeah, happier. That is why that's all I think. Not any kind of special fact or specific experience in my lifetime, but I think that was the reason.
Absolutely. I've seen a lot of happy babies in your social media. I've seen them smiling while you have taken pictures.
Generally, we pediatricians have lots of babies who also cry, but we only find the time to take photos whenever we can make them happy, and after that we take photos.
Yeah,
And yeah, I love children, and I love when they are smiling. I also try to make all of my patients happy whenever I can, definitely. And finally, if we also have the consent from the parents, then we also take some photos to make it visible for the society around.
yes. And how do you manage when the kids are crying? Because I've seen babies crying a lot. So how do you manage those situations?
Actually, as for us, for pediatricians, we know that children are the special creatures that may experience pain or may feel pain whenever when this pain does not really exist. And sometimes whenever they really have pain, they do not pay attention to this pain if they are correctly like I don't know how to say if mothers say if the doctor is also aware, then they actually do not get that afraid and scared, and their pain also goes away. And we every time try to psychologically help them first and then physically.
Absolutely. The kids must feel safe before they can express even pain to the doctors. Since I've seen you teaching a lot of subjects like pharmacology, microbiology, so which one would you say is your favorite subject of medicine?
That's a tough question, actually. I love lots of basic subjects that actually uh, kind of when you have the knowledge in the basic subjects, then all the other stuff in medicine becomes easier. That is why, like, all of the subjects have something that can be someone's favorite, that actually makes them someone's favorite. That is why I can't exactly say which one is my favorite subject, but I love teaching, especially when I share my knowledge to my students. I love the process, actually. I enjoy that very much. And especially, I love those seminars whenever my students also enjoy that I am teaching them. And this is actually kind of the cooperation love from me. I actually try to share the love. And when I also feel loved by my students, it increases my enthusiasm so much. And I can't say which subject is my favorite, but I can say that those seminars are my favorite whenever I share the love and my students actually feel that and give that love back to me as well.
Yes, absolutely. When the students are interacting, it feels so awesome, right?
Absolutely.
And also, you said, right, there are many subjects, and when teaching a subject or when even studying a subject by own, we must also have the knowledge for the other subjects. And when we integrate it together, that's when we know that, now I know this topic very clearly.
Yeah, absolutely. Because the every subject is kind of interconnected, and they are all about the one creature, human, right? Because we are doctors of humans, and yes, the different parts, different organ systems, maybe, or different like biochemical reactions are separated in different subjects, but in general, they are all simultaneously existing in one creature, humans. That is why studying all of the subjects and interconnect all of the subject knowledge with each other is very important for doctors to make the correct diagnosis, to understand the pathology of the disease, and to treat the patient correctly.
Indeed. And I would also love to let the audience know that you have been awarded Miss Empathy by your students.
Yes, last year I was awarded for this prize. My students decided to give me that prize to me, and I felt very honored because of that, because it meant so much for me. It's also I feel like I am loved by students when my students actually say out loud that I was like very empathetic towards them, or were very like good person for them. That is why I feel that I am loved, and I'm very happy because of that.
Yes, actually, even I've seen students, when I started the podcast, they were telling me that, hey, Jabirul, when can we have Bella ma'am on the show? Bella ma'am and Lela ma'am on the show.
Yeah, like our students also have trouble to tell us apart. And I every time feel that whenever like I go out, and say like I see some students saying hi to me. Like I think some students are actually. I every time realize my students, but some students are actually that I don't realize. Then I guess that this student must be Bella's students, my
Yes,
twin sister students. So I definitely say hi as well to all of the students that say hi to me, and they. It's good. I'm happy to hear that they are interested in my life and life hacks and lifestyle as well.
yes, they even sent us a few questions.
Special
And
questions.
yes, and one of those questions were like, how do you manage burnout or overwork? Which is actually very common in the industry, right?
Yes, absolutely. For doctors, it is especially very common, and you know, like managing these burnouts is really difficult for doctors. You sometimes definitely need to take some rest, especially like we appreciate the hours of sleep and hours of rest because we know how difficult it is not having a rest for the whole 24 hours or even more. That is why the my life hack would be just do everything right away. So what you have to do, just do it right away because in the future I won't have any more time to do it. And that is why you have time to sleep, just sleep. You have something to do that right away. You have something to study, just study that. You have something to write, just write that, and so on. So do not postpone your job. This is actually the main life hack that helps us in managing everything and managing time between the rest and the work.
Absolutely. It's actually a great tip to not procrastinate small things because when they pile up, it becomes a huge load, and then we feel that maybe I will not do it today. Maybe I can do it tomorrow, and then tomorrow never
Yeah,
comes.
exactly, exactly. That is correct. So that is why I every time tell my students then do not procrastinate, do not postpone anything, just do it right away. Even if you don't feel ready to do it, just do it.
Yeah, just do it. And how about life hacks? Do you have some of your personal life hacks to manage being a doctor, being a lecturer, and also being a dancer?
Actually, being a dancer is kind of a life hack for being a doctor as well, because I think that every people need, every person actually need to have something, some job that will make them physically tired but psychologically kind of renewed. And when you actually cognitively get tired and your mind is completely tired and burned out, you have to somehow change your path in that. For example, during the day or during the week, you have to just cognitively rest and get tired physically. And when I dance, for example, someone may actually go for workout in the gyms and so on, but when you do some kind of workouts, your mind is resting and you actually exercise, gets tired physically, and your mind do not have time to think about the problems, to think about all that tiring work schedules and so on. That is why it is kind of the life hack that makes me available to do all that stuff together because I get tired physically but rest cognitively, psychologically, and then I gain some strength to do my job next day even better or again.
You actually mentioned a very good point, which some actions are, projects which tire us physically, but they power us up psychologically. You actually mentioned, yeah,
Absolutely.
that was actually very enlightening for me as well.
For you as well.
Yeah, and no, there was one of my friends actually asked me to ask you that as doctors, what is something doctors possess that something like a like doctors do they have some kind of privilege as compared to other people? Like what is that one special privilege for doctors?
Special privilege. I have not thought about the privileges like from that view, but maybe trust, I would say. Like, of course, there. I also tell my students that none of us will be liked every time. Sometimes we can also be disliked. But if a patient comes to us, means that they chose us as their doctors, so they actually trust us, and sometimes they trust doctors even more than themselves. They actually find doctors sometimes as gods or someone who will save their lives or health and so on. That actually is kind of the privilege, but also a huge responsibility as well. So
Yes, it is a huge
we
responsibility.
should use that privilege, but definitely we should also realize our responsibility that the people's trust gives us.
Indeed. And how would you say, how do you actually manage to build trust in challenging situations? Because sometimes
Trust,
the patients might not like us, or maybe they are not opening up to us initially. So how do you build that trust and mutual connection with difficult patients?
yeah, actually, the communication skills is very important for every doctors. You should actually uh, try to warm up with the patient first, especially for pediatricians, not only for patients, but also for patients' parents as well. So, especially for us as young doctors, some parents may not be that they may not trust us that much because of the age. Like every doctor, I think that would face that when in their young ages. That is why first, you just have to be very polite and warm to the patient or the patient's parents, and then you just uh, should find the time to explain everything that the patient has a question about, and you just have to show them your knowledge and your empathy. I would say exactly this as well. So if the patient sees that you are empathetic, you are actually really care about them, and you are also full of knowledge that's actually is necessary to help them, then they will trust you.
Yes, kindness and empathy is like the main the factors of being a great doctor. Because unless the patient trusts us, they will not open up to us and even not tell us the actual truth, which is required for the diagnosis.
Yes, you're absolutely correct. So, unfortunately, it does not happen every time that every patient does not trust doctors, but somehow we should manage that. If the patient actually feels safe with you, and if the patient actually really feels that you definitely care about them, about their health issues, about their psychological issues or physical issues, then it is highly likely that they will tell you the real truth, and they will trust you, and you will actually collect the correct anamnesis, and finally, uh, probably you will also diagnose the patient correctly and treat the patient correctly.
Absolutely. And I would also love to ask you about, has there ever been any difficult moments in your own practice of being a doctor? Any difficult moments or something which was very hard for you to accept?
Unfortunately, such kind of moments happen in every doctor's life. Actually, I was a junior doctor in that case, but we had the patient that we could not survive, and that was really hard for me and as for the other doctors as well. But such kind of cases should not demotivate you, but that actually should motivate you even more to become even like stronger doctor with more knowledge, with more general practice, and so on. That patient, actually, I would not talk about that patient, but it was actually the terminal condition, and we could not just survive, but all kind of, no matter how terminal the condition is, every time that you actually you feel really stressed whenever you can't help your patient. So that is definitely really stressful, especially for those doctors who feel the patient's pain, who feel the patient's who understand the patient's condition, and really feel and care about them.
Yes, because as doctors, we have a connection, a personal connection towards each patient, right? And if anything unfortunate happens, it feels like we have lost something very personal.
Yes, absolutely correct. And I hope I won't have any such cases in future as well. And I wish all the doctors really the same, that more patients will survive, much more energy we get, and much happier we feel. But unfortunately, there are some conditions that are not treatable, and this is also very stressful for every doctor.
Yes. And in those challenging situations, how can doctors control their emotions? Because as doctors, we cannot show our emotions every time. We must control them and always be
Uh,
composed.
uh, Actually, in that very moments, you may actually think about just pragmatically at first, and you just try to do everything. I think that every doctor is like that. So whenever you have some kind of critical moment, it you don't get emotional on that very moment, because you think pragmatically, and you think what you should do next, first or next, and so on, in order to do maximum for your patient and to survive the patient's life. But if something bad still occurs, then I think that it's totally okay to show your emotions, to share the emotions of patients, relatives, and so on. I think that it's totally okay. But before, like, you are fighting between life and death, then I think that emotion does not just come. You just think pragmatically. So I can't say how you manage that. It's just naturally like that. That you don't get emotional right in that very moment. But if still something does not go well, then you may get emotional. In that case, I think that it's quite normal. We are also humans, doctors, so we may also show our emotions. So I think it's totally okay.
Yes, it's totally okay to show emotions sometimes, right? And I have a question for you. So, as doctors, we have different mindsets, right? We have different thinking ideas. So, has there ever been a challenge between your own thoughts and ideas while treating a patient or solving a case?
Can you please repeat your question? Like, do I have any
Yes.
specific idea?
Yeah. So, as doctors or any human being has different ideas within himself, right? So, while solving a case, has there ever been a challenge between your own thoughts or ideas?
Um, I can't remember such kind of cases. If I have like some kind of conditions or cases. When I suspect about some kind of conditions, I every time try to exclude that condition, and fortunately, I had some patients that whenever the correct diagnosis was made, it was actually kind of life saving for the patients. And these are the moments when you really feel that, oh, this is the moment what the life versus for. And this is actually also the moment when you think that, oh, this is how being a doctor feels. Really feels, because in other cases, whenever we have like mild cases and so, it's everything is going regularly. But in such moments, whenever we have patients that actually would be dead, or even not very healthy, if you could not make the correct diagnosis, then in that very moment you really feel very happy because you were a doctor in that case. And I can't remember like this any specific case that was very challenging, but if I have something interesting, I every time share my suspects. I every time do the test in order to exclude the most dangerous conditions, and then if the dangerous conditions are excluded, then we go to the according to the guidelines with like milder to treat the cases they really have, patients really have. So uh, like uh, fortunately we could uh, manage to treat every patient up to now in pediatrics. Just that one case that I had in my career was actually the uh, worst experience for me, and I hope that kind of experience I will never have in my future.
Yes, and we can learn so much from just a single case. It gives us so much feedback, so much data, and we learn so much and grow as a human.
Definitely, every patient makes you grown up somehow.
Yes. And as a doctor, like how do you find time for yourself? Like let's suppose you have a lot of patients, you have 10 patients coming in every single hour. So do you ever feel bored about it or feel like no, I'm not in the mood to check patients right now. I need some time for myself.
Every person may get tired physically, uh, yeah, including doctors as well. So after the 24-hour shift, every doctor is like that. Oh my God, I want to go home and have some sleep right now. But before you are on your shift, or before you are with your patients, I think that you don't feel bored or you don't feel like tired during that time. I don't feel tired during that period of time. I don't feel that I can't do anymore. But whenever my shift is done, I just really want to have some rest. But before my shift is done, before I am the responsible person there somewhere in the hospital or somewhere else, then I think that I'm I don't feel tired in that case, or I can't feel bored because I am there like to help others, and I really don't feel exhausted no matter how exhausting shift it is. But whenever I finish, then I feel everything right away.
And also solving cases makes you feel like a superhuman, right? And you feel so
Yeah, if
energized
it's
when you solve cases.
Yes, if it is like very interesting case that was not thought before, you suspected first, and like you made the correct diagnosis, then it definitely makes you feel special, and that is really great sensation. That is when you really feel that being a doctor is something great.
Yes. Can you actually share a specific incident which made you realize that this was the best decision of my life to become a doctor?
To become a doctor was the best decision of my life.
Yes, any specific
Actually,
incident?
there was a yeah, there was a case at one of the hospital where I work, and there was a boy who actually was very badly injured, and we helped him, and we also made him calm and so, and I also spoke with him and tried to show my empathy and show my love and how much I would care, and whenever this boy felt better, he just thanked me, told me a great thank you for my speech, for my empathy. He just told me that he was very, very thankful that I was with him. So that was actually a very, very great moment, actually, because I just felt that my love was seen, and whatever we tried there in that boy, everything was actually kind of went well, and fortunately the boy also became better, uh, physically and psychologically as well. And when someone gives you we doctors don't do anything to get thank you in response to our job, but whenever someone sees what we have done and they say thank you and they are grateful uh, for that, we definitely feel special in the case. Every such kind of moment is very beautiful.
Absolutely. When you treat a patient from the ground level and he becomes well and comes back to you and says, "Thank you, doctor, for being with me in the difficult time," it feels so good.
Yes, this is actually these are the moments that really gives us energy to continue our exhausting and very responsive, very very hard work.
Yes, we must always strive for happiness in the small things and not get distracted by the everyday routine tasks.
Yeah, I absolutely agree with you. Like this concerns to not only doctors but also for other people as well. But if I think correctly, I don't know, other profession people, like people with other professions will agree with me or not, but I think that being a doctor is most tiring. You have the highest responsibility because you are responsible for humans' lives. That is why our job is very, very exhausting. While maybe the salary may not be that much, right? But there is something that gives us enthusiasm and energy, and I think that this energy is every patient that became better because of us, every correctly made diagnosis, and every thank you that is told by the patient, grateful patients. So I think this is the energy for that much hard work.
Absolutely, it feels happy. It feels so happy.
Yeah,
And also,
absolutely.
on your Facebook page, I've seen that you live by the quote of "How to make the world better with my life." Can you please tell us more about that?
Actually, this is kind of my life motto. Um, I have a great mother that every time tells me that no matter how you are, no matter where you are, just share love. And I also think that sharing love is something that makes the world better. If you can actually cause someone smiling, if you can be the reason of someone is happy, that already makes you available to make the world better. And I every time try to make the world better, however I can. Like I every time try to share love to my students, to my patients, to my colleagues, like every to my group mates, and I think that whenever you try to make the world better and you share your love, then you get that love in response to it, and that actually kind of brightens your personality or your days, and these are so this makes me happy. So I think that if every people were like that, there would not be so many wars, not be so many crimes, and the world would be a better place to live.
Yes, that is so right. Because the amount of love we give to the world, we receive 10 times back. It's just a matter of time when it comes back.
Yes, like it's probably like that. Sometimes we may actually share loves, and we may feel that, oh, I am the only one who shares the love, and I don't get anything back, or I like I'm not loved back, or something like that. But it still will come back sometimes, and you will definitely feel that.
Yes. And apart from this motto of your life, is there anything else you also live by? Maybe you have some personal rules for yourself that you follow.
Yes, I actually have several rules that I every time share to my students specifically because those are the people who I have much more time to contact with. And one like I can share several of them. The first one is just you have to have the courage to fail, because failure is not actually losing. Failure is just a step to become a winner, and that is why we must not be afraid of failure. uh, Another motto that looks like this, and I've also mentioned it before, is courage to be disliked. It is a little bit different because no one can be liked by everyone. We can also be disliked by some people, but it should not demotivate us and should not steal our courage. You have to have the courage to be disliked means that you can do great jobs in your life. No matter some people may like you or dislike you, you will actually reach your goals. And I think, as you also mentioned, the one important thing that we have to realize is that we have to find happiness in every moment we have uh, in our life. The main thing is that we should be grateful for everything what we have, and if we feel this gratefulness in ourselves for the minutes that we are alive, for the every morning that we woke up, for the every night that's actually the day went peacefully, and so on, then I think that we would find a lot of reasons to be happy. And when you are happy, you can do your job much better and reach your goals much fluently.
Yes, and I also believe that in this age, which is full of stress, being grateful actually helps us reduce all of the stress and have positivity.
Yes, absolutely, absolutely. And if you are positive, you share your smile. Someone also gets this smile, and then they share smile, and everything becomes like everyone becomes happier around you. So that's much better.
Yes, like spreading positivity and happiness, it feels so good. It even lifts up your own mood and takes away the stress.
Definitely. When you like for me as well, like when I share the love, when I smile to others and get something back in response to that, I feel happier and I think this concerns to every person around the world. That's whenever other people smile at them and like are good to them and positive towards them, they also feel happier and less stressed, and their day also goes great.
Yes. And in your spirit of making the world better, spreading love and positivity, what tips would you give to the upcoming doctors for the next generation?
Like advices to
Yes,
the doctors, future doctors.
yes, so that we can
Mm.
have more positivity and happiness.
More positivity and happiness. Okay, first advice would be that like do not postpone your job, do not postpone whatever you have to do, just do it right now, because while you postpone the job you feel stressed inside yourself that I have something to do in future. When you don't think about it and you just do it, it actually decreases the stress, but also increases the self-esteem whenever you have done some jobs that was necessary for you, and try to manage your time like between the work and the relaxation. It does not matter what kind of relaxation, what kind of relaxation you would like, but actually you should actually also in order to get physically but mentally powered up and relaxed. And after that, everything becomes easier.
Yes,
So do everything right away and also manage your time to have some rest with a lot of work.
yes,
Pick up any hobby you like and like follow that as well.
yes. And just to make sure that I have not missed a point, so we must do everything on at the same time that we plan to do and not postpone it. We should also try to
Absolutely.
be grateful for every small thing that happens to us, and also try to stay positive and energetic whenever we can.
Absolutely, absolutely. So I think that these tips will help to all of the doctors and not only doctors, but especially these tips are necessary for doctors as we have hard time to manage our schedules.
And I believe one more important thing should be to focus on the relationship that you have with patients, to be very empathetic
Yes,
and
yes.
kind. Yes, one more thing is
Um,
that to build a great relationship with the patients, to be very kind and empathetic to them.
Yeah, absolutely. Because if we don't feel empathetic, if we do not actually love our patients, if we do not care about our patients, we would not think for themselves, and we may not be able to totally treat them so well. That is why I've chosen pediatrics, because I loved children so much and I love them as my patients as well. And if I don't love my patients, I think I can't help them that much. That is why that was the reason why I chosen pediatrics.
Yes, but how do you manage to know something when the kids are not able to express it? That
Yeah,
should
there
be
are
very
some
challenging.
children. Actually, these are already the tips of pediatrics themselves. There are several like signs that children may actually not be able to tell, or children because of their age, or because they don't know how to express their feelings, or because they just don't want to share them to you. But there are some tips that we pediatricians can guess whatever which part of the body can be painful, or what kind of conditions can there be, and we try our best to guess the conditions, and then suspect the specific diseases and treat them, and help our patients as much as we can.
Yes. And I have one final question for you. And
Okay.
I have always wanted to know this. So, which one is your favorite hobby? Because I know that you do jujitsu, you do swimming, you also do dancing. So, which one would be your favorite one?
Actually, if I would say as a favorite, I would say dancing, because I've been dancing for about 18 years, and it is kind of the part of my life. It's kind of the passion for me, and I would say dancing if I had to choose one of them, because I can't imagine my life without dancing, specifically Georgian folk dances. That I've been doing that. So it's just relaxation. And as for the jiu-jitsu, I've been doing jiu-jitsu for several months, because I was dreaming about that in childhood and I could not manage that. But then I thought that if it was my dream, why should not I make my dream come true? So I tried it. I enjoyed that so much. It was very enjoyable. But actually, I could not resist dancing, and continued dancing, because it was the greatest passion for my life.
Yes, and actually, it takes us back to your point that we should not be afraid to fail. Because as kids, we have a lot of dreams, and when we grow old, we feel like maybe I should not do it now. What if I fail in this hobby? But you had the courage to start again and follow your dream of jujitsu as well. That's actually very amazing.
Yeah, actually, I every time tell my students as well that you should not be afraid of failure in your dreams as well, because if you do not start, if you do not try, it means that you are already failed, and if you try, then you actually know that you have at least tried, and no one knows. You may actually become very successful in that stuff that you will try. And if you won't become, if you actually are not successful, then you somehow feel like satisfied in yourself that you have tried, and you did not give up before you have started. Sometimes it may affect your self esteem if you try something and it does not come out as you wish. But you should, in that case, you should try and try again, and never give up.
Yes, we should always, raise back up and keep doing it because we never know. This might be the best thing that we have tried in our entire life.
Yeah, absolutely. Yeah, actually, that Thomas, I like this story. Thomas Edison have tried for about 1014 times to lighten up his first light, and he just was successful after so many tries. But if he has stopped up to like 1000 tries, then he would not be an inventor, and now he's in the history. So that is why if we have passion something for something, and if we really want to do something, we should never stop trying.
Yes, absolutely. We should always believe in ourselves.
Yes, absolutely. Believe in ourselves and our dreams.
Yes. And actually, that brings us to the end of the podcast. Thank you for being here. on Medico Memoirs, and it was a great conversation to have with you.
I'm very thankful that you invited me. I hope the audience of your podcast will enjoy our interview, and I wish you all a happy life. And personally, I wish you a successful podcast experience in the future as well.
Yes, thank you so much.
You're welcome. Goodbye.
Yep, goodbye.
And that concludes another episode of Medico Memoirs. If you enjoyed today's episode, make sure to subscribe, leave a review, and also share it with your friends and fellow colleagues. Remember, we are here to empower your health journey, bridge knowledge gaps, and also promote health equity. Until next time, this is Jabirul signing off from Medico Memoirs. Take care and be safe.